Hi everyone. My name is Dr. Vaibhav. I'm from a small city, Bundi, Rajasthan. I have secured AML of rank 4 and CML of 6 in this October INI-SS Neurology super specialty. And I did my undergraduation from Grand Government Medical College, Mumbai, and post graduation from Dr. VMGMC, Solapur, Maharashtra.
Heartiest congratulations, Vaibhav. You made it very humble and very, I would say, simplified, though I can understand the exact amount of hard work that you have put and the struggles that you've gone through. So heartiest congratulations on part of PrepLadder. And well, the very first question is that for between NEET SS and the INI exam, there's a huge difference as far as the type of questions is asked, because when it
Yeah.
comes to NEET SS, I think the pattern is much more unpredictable, and INI has more of a predictable pattern. So how did you go about managing the difference between the two?
Sir, actually, after I completed my MD in July 2023, I was very sure I want to do my DM from Apex Institute only. So I didn't even apply for NEET SS. I didn't even study. I didn't prepare for that. I started preparing only and only for INI-SS. And I focused my 80% of time for the neurology subject, as maximum questions comes, 50, 60 questions comes from that part. And every day, 2 to 3 hours or sometimes 4 hours, I used to give to general medicine part. That's how I went with the pattern.
So any topics that you would like to tell to the future aspirants? Because now I think your inbox would be full with messages from the
Yes, sir.
future aspirants. So
Yeah.
we can use this as a medium to tell them about those hardcore topics which are always going to be asked in INI. And I mean, there's no amount of, I mean, there should be no effort spared in reading them up. So can we just enumerate or list them up?
Yes, sir. As we all know that though the exam is unpredictable, but there are two, three topics which I think everyone should be tiptoed on those topics like stroke, everything from basic localization anatomy till the management part, specifically the management part, the epilepsy part, epilepsy, its treatment, status epilepticus, everything, and the peripheral neuropathy part. There's always one or two questions from that part. So these three topics, I think everyone should be fairly be good to if they want to go for INI-SS.
Okay. So, Doc, I think time is the most precious commodity, and you would be very busy with your postings, especially taking care of patients, and then obviously, going through the routine exams in the university as well as in medical college. So, I mean, how did you go about balancing between studying for this particular exam and then managing your duties as well?
Sir, till my MD, I was purely focused on the patient care, and I was reading from Harrison. That is everything I did. The actual preparation, the preparation for the entrance exam, I started. I exactly know the date, 10th of September. So that 1.5 months, I gave my whole. I left my job. I did everything. I just studied for 15, 16 hours every day, and that's how the result came.
Wow.
And everything, I think the reason I was able to do it in 1.5 months was my basics were clear during my MD residency. So that was the main part. While treating the patient, your basics should be clear so that later you can learn the better part of that.
Okay. And as far as the QBank or PrepLadder is concerned, how did it help you in your preparation?
Sir, QBank was really good. Just reading the notes wouldn't have helped me a lot for answering the questions. You should know where to go, how to look to the options and how to answer it, because answer is in front of you. You just have to eliminate the options. So in that way, Question Bank helped me a lot, and specifically the clinical based questions, the clinical scenarios which were there. So they also helped me to apply the knowledge which I have learned. Plus, I think the biggest advantage was doing the negatives. I used to do many negatives. So after solving the MCQs, my negatives decreased, and I think I performed best of my during the main exam only.
So, like, what was Vaibhav doing 1 week before the exam? Were you a bundle of nerves? Were you all cool about it? Yeah, man, I'm gonna do it.
No, no, no. I was. My room is on the first floor at my home. I was just running up and down. I was going to my mother. I don't know. I'm forgetting everything. I don't know anything. She just told me just focus. You have learned. You have read everything. Everything will be good. And I did my last GT, last test of PrepLadder 4 days ago, and I scored good rank in good marks in that. Around 60 questions were right. So I was happy by then. Okay, I can do it. So there's no problem, and I was revising my notes only.
Okay. So let's take up like 7 days before the actual D-Day when you went for the final assault. So those 7 days, what were you mainly doing? Were you focusing on, I mean, major chunk of your time was on MCQs or major chunk of your time was reading the notes?
So a major chunk of my time was reading the notes for sure because I didn't want to go to that negative psychology part that okay, even now my MCQs are getting wrong. I'm but bit scared about that thing. But what I did was not to leave that practice. I have bookmarked the questions MCQs. So I solved those bookmarked MCQs, which were good clinical scenarios or those things which I might forget again. So I bookmarked them and I did those things. So around 1 to 2 hours for MCQs and rest time for the theory and notes.
Okay, so these notes, they were handmade by you or they were like
Yeah,
printed?
handmade,
Handmade
handmade, sir.
notes. They were
Yeah,
a combination of Harrison and a couple of other books.
mainly Harrison, sir, and a few things were from Bradley. The major
Mm.
tables, those topics we talked about. In specifically those topics, I would look for the Bradley also.
Okay. So, I mean, considering the fact that a lot of people who would listen to this would ask you this question that how much time should they invest in Bradley when they are actually in doing their MD? I mean, should they be doing Bradley at that particular point of time, or should they just focus on doing Harrison and then Bradley comes in the last?
Sir, I think so. Harrison is everything. They have given each and everything in the Harrison. Some parts, obviously, there are some things which are given in Bradley, but rather than halfly reading both the books, I prefer going thoroughly with one book. That is my way of studying.
Mhm.
So I went completely with Harrison. While solving the MCQs, I felt like, okay, there are few points missing. There are few, I have to jump from this logic to that logic, and that logic is missing. So for those things, I read the Bradley part, but only the tables, not text. I haven't read the text part of Bradley.
So, Doc, my last question to you, what inspired you to take up neurology? What was that thing that said that, okay, I'm going to be a neurologist?
Sir, in my first year MBBS, I'm not that a studious kind of person, but in my first year MBBS, I used to read neurophysiology and neuroanatomy a lot. And when in my third year, my MBBS, my professor told me that this is one subject in which you can learn everything. You can come to a diagnosis only by taking history if you know how to take proper history, which is not possible with all the other faculties. So I was very mesmerized with that point that by only my mind and me sitting, not even any other investigation or examination clue, I can come to a diagnosis. That is a very great thing. So that's how I started liking neurology.
Wow, that's great. Very inspiring. And I must appreciate the fact that you are being very humble and very modest about your achievements. I wish you the very best for a great, great career ahead. And if you want to make any dedications, the few minutes are here before you for parents and anybody else, if you would like to say a few words.
Sir, I believe in luck and God a lot. So I think God was beside me while preparing for this because clearing INI-SS in 1.5 month is not a small deal.
It's a
And
big deal.
secondly, maximum I can give it to my father. He took care of me like anything during these 1.5 months. So these two people were there. Mom was also there, sister was also there, but God and dad, they were like the two pillars on whom standing I cleared this exam.
So great, doc, great talking to you. And I hope that students and the future aspirants find the words of wisdom from you very productive and they are able to come out with a similar kind of performance in future. God bless you and nice talking with you.
Yes, sir. Thank you, sir.